The base of the neurocranium has two surfaces, an inner surface called endobase and an outer or external surface called exobase. Today we are going to talk about the endobase or the basis cranii interna, which has three separate areas. They are located at three different levels, as you can see here: superior level anteriorly, middle level in the middle, and posterior level the deepest, so to speak. Now they are called fossa cranii anterior, fossa cranii media, and fossa cranii posterior, the posterior cranial fossa. We are going to talk about their limits, borders, and also bony surfaces, communications, and features. So fossa cranii anterior is bordered from posterior by this line here, which consists of the free margin of the ala minor of os sphenoidale, so the lesser wing of the sphenoid bone. And in the midline is bordered by sulcus prechiasmatis that runs on the superior surface, transversely on the superior surface of the body of the sphenoid bone. So this is the separation between fossa cranii anterior and fossa cranii media, while the separation between the other two is the margo superior partis petrose ossis temporalis, so the superior margin of the temporal bones and petrous part on the two sides, symmetrically. And in the midline we have the dorsum selle of the sphenoid bone's body. On its two lateral sides we have processus glenoideus posterior, both of them symmetrically placed. Now for the anterior cranial fossa, the bony surfaces are as follows. Anteriorly we have the two symmetrical pars orbitalis of the frontal bone, so the orbital parts of the frontal bone. In the middle, between them, in their incisura ethmoidalis, we practically have the ethmoid bone. Ethmoid bone's parts. Here we have the horizontal plate of the ethmoid bone and also a protrusion from the vertical plate of the ethmoid bone called crista galli. And then the posterior surface of the same fossa is created on the sides by the dorsal surface of the lesser wings of the sphenoid bone, ala minor ossis sphenoidalis, and in the midline, in the middle, by the superior surface of the body of the sphenoid bone. Communications are pretty straightforward. We will have, and in order to visualize them better, I'm just going to try to put through this pointer. So we have a lot of small little openings in the horizontal plate of the ethmoid bone. We also call it lamina cribrosa because of that. And the foramina cribrosa, the openings, one of them I put the pointer through, are communicating with the nasal cavity right here, as you can see inside, letting through the fibers of the olfactory nerve. Then we have a non-communication, but nevertheless still an opening or something like that. This is called foramen cecum. It's a blind-ended opening that is at the end of crista occipitalis transversa. It's at the end of crista frontalis, obviously. And we have two other communications that are practically, one of them is a true communication, the other one is not. And they are the two ethmoidal openings that are from the orbit. They are passing through from the orbit into the anterior cranial fossa. So eventually I was able to push through. They are called foramen and canalis ethmoidalis anterior and foramen and canalis ethmoidalis posterior. And they are creating communications between the orbit and the endobase and the orbit and the ethmoidal cells. Now I was able to push the pointer through foramen ethmoidale anterior on the other side, and as you can see, it appears inside the orbit like so, on top of, inside the endobase, on top of lamina cribrosa, and the vascular nervous bundle that's contained within is going to pass through the cribriform plate into the nasal cavity. While the other communication, the foramen ethmoidale posterius right here is not going to penetrate all the way to the endobase. It's just going to go into the posterior ethmoidal air cells. So these are the communications. Now the features of the only features that are present here are the already mentioned crista frontalis, that belongs to the frontal bone, the crista galli, which is the superior protrusion of the vertical plate of the ethmoidal bone, and obviously the impressiones digitate that are created by the gyri and sulci of the frontal lobe of the brain. The middle cranial fossa has a more complex structure than the anterior one. Its bony surfaces are as follows. In the midline, we have the corpus ossis sphenoidalis with its superior surface. Then to the sides, we have the ala major of the sphenoid bone as well, and the two lateral surfaces of the body. And posteriorly, we have the anterior surface of the pars petrosa, ossis temporalis, and also the pars squamosa or squama temporalis participates in the floor of the middle cranial fossa. Now, communications of the middle cranial fossa are as follows. We have first here the canalis opticus that is created between the two roots of the ala minor as it attaches to the body of the sphenoid bone, and it creates a communication with the orbit as demonstrated here. Yes. Then right under the lesser wing, and between the lesser wing and the greater wing, we have another large communication which has a slit-like structure, and it's called fissura orbitalis superior, and obviously it will create a communication with the orbit through superior part. Now the next one is the horizontally going foramen rotundum. Foramen rotundum is on the side, is on the lesser wing, and as you can see here, it is going to eventually end up in fossa pterygopalatina on the maxillary or celomaxillary surface of the greater wing. So this is foramen rotundum. The vertically going foramen ovale is going to exit the skull on the exobase on the infratemporal surface of the greater wing, and it is going to thus connect the endobase to the exobase again. The next communication is going to be the foramen spinosum, which is similar to the ovale, in exiting on the inferior infratemporal area of the greater wing. So we have three major communications here: the foramen rotundum, foramen ovale vertically going, and foramen spinosum also vertically going. The next communication is an opening that is created at the junction between the apex of the pars petrosa, the ala major, and the body of the sphenoid bone. This is called foramen lacerum. It creates a communication between the endobase and the exobase, but in a living person it's not really an opening because it's closed by a cartilage and only some nerves pass through it. The next communication is a large one, and it practically is a tunnel, a bony tunnel that holds an artery like so, the arteria carotis interna, and it is called sulcus canalis caroticus, and as you can see it exits the exobase in the lateral posterior middle part, canalis caroticus, and arteria carotis interna will enter the skull here and continue upwards in sulcus caroticus towards the brain. Then we have also here the two little tunnels or little communications towards the inside of the petrous part. We call them hiatus canalis nervi petrosi majoris, and underneath right here hiatus canalis nervi petrosi minoris. As you can see, they continue in two grooves sulcus nervi petrosi majoris and sulcus nervi petrosi minoris, and they are headed towards foramen lacerum because both nerves will enter this opening here. Then we kind of are done with the communications, and the bony features of the fossa are as follows. We already mentioned sulcus prechiasmatis, the free margin of the lesser wing of the sphenoid bone, which ends here in processus crinoideus anterior. Tuberculum selle is the anterior border of the sella turcica. Dorsum selle is the posterior border of sella turcica, with two processus crinoideus posterior. Then on the sides of the body we have sulcus caroticus on both sides, and then ala major with the communications we already mentioned. Now on the anterior surface of the greater wing of the pars petrosa, we will have impressio trigeminalis right in front, anteriorly here. We will have eminentia arcuata, and we will have tegmen tympani, the roof to the tympanic cavity. The last thing that I didn't mention is practically the sulcus arteriae meningeae mediae, the middle meningeal artery groove that starts at foramen spinosum. Since the artery enters the skull here, it will continue right over to the calvaria. The posterior cranial fossa is bordered, as mentioned before, anteriorly by the margus superior partis petrosae on the two sides and dorsum selle. On margus superior partis petrosae we have this groove which we call sulcus sinus petrosi superioris, while the other groove that has a similar name, sulcus sinus petrosi inferioris, runs at the posterior border of the pars petrosa between the petrous part and the occipital bone. The bony surfaces here are created by most of the, all of the occipital bone and the posterior surface of the pars petrosa. So we have facies posterior partis petrosae, pars basilaris ossis occipitalis, pars lateralis ossis occipitalis, and squama occipitalis right here. Although the posterior fossa ends here at the level of sulcus sinus transversi. The communications of this fossa are pretty straightforward. Obviously we have foramen magnum, which communicates with the spinal canal and contains a lot of anatomical elements, among them the spinal cord obviously and its meninges. Then we will have the communication we call foramen jugulare for the exit of the vena jugularis interna, or the start of vena jugularis interna. We will have the so-called meatus porus initially as the opening, and then meatus, the conduct, acousticus internus, so meatus acousticus internus, entering the petrous part into the inner ear. Also, we will have a communication to the side that will cross the base of the occipital condyles, like so, transversally. This is called canalis hypoglossi, and we will have a communication that will cross the base of the same condyle, but this time transversally in an not transversally, but in an anterior-posterior direction, going into the skull and ending in sulcus sinus sigmoidei, which eventually will hold communicating vein we call vena emissaria condylaris. And then also easier to point from posterior is the tunnel, maybe here on this side, is the tunnel that we call foramen mastoideum, which will eventually, not easy to push through, will create a communication with the endobase here at sulcus sinus sigmoidei, holding another emissary vein we call vena emissaria mastoidea. So these are the communications, and the features inside here are the following. We have clivus, that is the basilar part of the occipital bone, on the basilar part of the occipital bone. Also mentioned already sulcus sinus petrosi inferioris. Here we have a gap apparently between the two bones, but this gap is bridged by cartilage. This is where we have the synchondrosis or sutura between these two bones, the petroccipital suture. Also, the synchondrosis between the sphenoid body and the occipital bones basilar part is called synchondrosis spheno-occipitalis. Now, at the level of the foramen jugulare, the jugular foramen opening, we have tuberculum jugulare inside here, processus intrajugularis right there, inside the incisura jugularis on the occipital bone, and processus intrajugularis here on the temporal bone, inside its own incisura jugularis, which is right here. Then tuberculum or processus jugularis is hidden here underneath the petrous part, so it's readily visible on the outer surface right here. This is the processus jugularis that is bordering posteriorly the incisura jugularis, which is right here on the occipital bone, with processus intrajugularis then, and processus jugularis in the posterior area. The next thing is to discuss the surface, posterior surface of the petrous part. So we missed, after the meatus acousticus internus, we missed fossa subarcuata right here, and apertura externa right here, apertura externa aqueductus vestibuli right there. It's lateral to the meatus acousticus internus. And already on the mastoid part of the temporal bone, we have this sulcus sinus sigmoidei, which continues the groove we call sulcus sinus transversi, which is a symmetrical groove going in both directions, left and right, and continuing in the sigmoid sulcus on both sides to exit via the foramen jugulare, thus ending the intracranial venous system. Now, on the squama occipitalis, as we remember, we have the eminentia cruciformis, created by protuberantia occipitalis interna, crista occipitalis interna, and sulcus sinus sagittalis superioris. On the two lateral arms, we already mentioned as sulcus sinus transversi. This eminentia cruciformis will create the four depressions. We call them inferior ones fossa cerebellaris and the superior ones fossa cerebralis.